In this presentation, I will talk about the tooth displacement injuries, which is the second part of the traumatic tooth injuries. The As we have said before, that the most important disease of our teeth pulp, which is the pulpitis, is caused by biological, physical, or chemical factors, or a combination of these factors. And in the previous video of the tooth fracture injuries, I have said that the tooth fractures are an example of this type of combination of the factors. But here also, a combination of these factors may be caused by a tooth displacement injury. The displacement injuries in general are four types: the concussion, the subluxation, luxation, and avulsion. The concussion, as we have studied in the surgery, that the concussion is the shaking forwards and backwards of the brain, leading to a changed mental situation. For example, there will be a few seconds of unconsciousness. The same here is for our teeth. When there is a concussion in our teeth, it is it means that there will be a shaking of the tooth forwards and backwards, but or not but it is associated with a mental change in it, because the pulp of the tooth is like the mental of us, which is the brain of us, so that the brain of the tooth or the pulp will be concussed, and there will be pulpitis, reversible pulpitis, and pain. But there is no movement nor displacement of the tooth. Okay, so that when there is a tooth concussion, there will be only pain with no movement nor displacement. The treatment for this case is no treatment, only observe the tooth and see if there is a possible need for an endodontic treatment procedure in the future. The second type, which is the subluxation, which is characterized by the presence of pain and movement, a little movement, but without no displacement. And the subluxation is treated by the splinting of the tooth for 2 to 4 weeks or less until the movement is gone. The third type of the displacement injuries is the luxation. The luxation is characterized by the presence of pain, movement, and displacement of the tooth. And this displacement might be outwards or extrusive, inwards or intrusive, or laterally, which is the lateral displacement injury. The extrusive laxative displacement injury is characterized, as we can see here in this picture, by the extrusion of the tooth from its socket. And the treatment of this luxation injury, displacement injury by the replacement of the tooth to its place, either with a hand or ortho treatment. Here we will use our hands to replace the tooth to its place. Then after the replacement, we do supplanting for 2 to 4 weeks and observe the tooth for a possible need to an endodontic treatment procedure, or extract the tooth if necessary, and that is only in the primary teeth when the extrusion is more than 3 millimeters. We measure the incisal edge place of the tooth that has extrusion with the incisor edge of the adjacent tooth, and measure the millimeters of extrusion. If it is more than 3 millimeters, leave the tooth, extract the tooth if it is a primary tooth, and do not replace it. And of course, that depends on the clinical situation. The second type of the luxation, which is the intrusion. The intrusion, again, like any luxation displacement injury, we do replacement with hand or ortho, and in this case we do the replacement with ortho treatment, and then retain the ortho appliance for supplanting for 2 to 4 weeks, and then observe for endo treatment or exo if the tooth is again primary tooth and the tooth is gone on a permanent tooth bud. If the intrusion goes on a permanent tooth bud, we should extract that primary tooth. The last type, which is the lateral luxation displacement injury. And again, like any type of the displacement injuries, we do a replacement procedure with hand or ortho treatment, and then after the replacement of the tooth to its place, we supplant in that place for 2 to 4 weeks and observe it for a possible need in the future for an endodontic treatment, or extract the tooth if it is again a primary tooth but with a severe lateral displacement injuries. So that, guys, I want you to concentrate on the extraction part. We do extraction only if the tooth is primary tooth and has extrusion of more than 3 millimeters, or intrusion into a permanent tooth bud, or a severe lateral displacement. These are only the cases that we extract the tooth. Other than this, the tooth will not be extracted but will be replaced to its normal place and supplanted and observed for a possible need for an endodontic treatment. And the fourth and last type of the displacement injuries, which is avulsion. Avulsion is the complete displacement of the tooth from its place. And again, as any displacement injury, we replace the tooth in its place. But here we should clean the socket with normal saline, clean the tooth with normal saline and doxycycline and 2% stannous fluoride, and then do the replacement procedure, or as we call it here, reimplantation procedure. Supplant the tooth for 2 to 4 weeks and then observe for the possible need of endodontic treatment. Here I want you to know, guys, also that when I say endodontic treatment, I mean complete endo procedure if the tooth is a completely matured permanent tooth, and I mean pulpectomy and apexification if the tooth is an immature permanent tooth, okay, or pulpectomy procedure only if it is a primary tooth. So that these are the displacement injuries. I hope that you understand them. Always try to know, spread knowledge, and construct the world. Always try to be kind to others, and that is for the greatest benefit to the humankind.